I'm here with Polly Waite from the University of Oxford, who's going to be presenting a keynote and delivering a workshop at the summer conference for the BABCP. Polly, it's lovely to see you again. How are you?
I'm good, thank you, Shirley. How are you?
Fantastic, thank you. I wonder, would you be able to just tell us briefly what you're going to be covering, what the kind of elements are of the keynote, and then maybe say something about what you want to cover in the workshop so people can get a taster of what's coming?
Definitely. So in the keynote, my focus is going to be on the work that I've been doing. We're really trying to better understand and treat anxiety disorders in teenagers. So, we're all aware of the increased rate of anxiety difficulties, how they've increased over time, especially amongst teenagers. But it's such an interesting time of life because it's such an exciting time, lots of opportunity, lots of challenges too. So I'm going to be particularly focused in the talk on the work that we've been doing, thinking about key maintenance mechanisms, that are particularly relevant in this age group, and then really importantly sort of thinking about how we've been developing and adapting brief cognitive therapies so we can hopefully get in there early and deliver treatments that are both effective but also that are efficient.
Fantastic.
Yeah, and then the workshop is going to be a little bit different because that workshop is specifically on how we deliver brief cognitive therapy for adolescent panic disorder. And often when I meet clinicians, they talk about how, they don't tend to see panic disorder in teenagers or maybe not aware of how common it is, but actually it's way more common than people think. About 1 to 3% of teenagers have panic disorder. And obviously, if you have it in your teenage life, it's really disruptive when you're doing exams and all the kind of normal things that you'd be expecting to do at that point. And I'm sure people are aware of David Clarke's cognitive model of panic and his really effective treatment for adults that you would get if you were being seen in talking therapies in the UK. And we've basically adapted a brief version of the cognitive therapy to use with adolescents and evaluated it. So basically in the workshop, I'm going to give people an overview of firstly how we identify and assess teenagers with panic disorder and then how we deliver this brief treatment. So the workshop is going to be really interactive, lots of demonstration of key techniques, lots of practical activities for people to get involved in. And then hopefully by the end of the day, therapists will feel like they've got all the resources they need to be able to deliver the treatment, a really good understanding of what they do, and especially actually that they feel really confident to do behavioural experiments because they're a really key part of the treatment.
Brilliant. That's so fantastic. I think people often feel a bit nervous about behavioural experiments, don't they? So some really practical kind of overview of that and some really practical kind of demonstrations and opportunities to discuss different ways of doing it are bound to be really helpful. And what age band of the teenagers are you really sort of focused on here? Is it the top end, like 14 to 17, or more the younger end? Or
actually it's across. So the feasibility study that we did went from 11 to 18, but panic disorder tends to present sort of mid-adolescence onwards. Right. So we have seen 11 or 12-year-olds with panic disorder. So the treatment is suitable across the board, but typically it tends to be sort of 14 to 18 that we tend to see it more prevalent.
Fantastic. I mean, I'm so keen to see all these new developments in child and adolescent services because we've neglected them badly, I think, over the past few years. So it's time they got their time in the sun. So thank you so much for doing that. I'm sure it'll be a really popular workshop. So please come and sign up to Polly's workshop and don't forget to come to the keynote as well. And Polly, it'd be great to see you at the conference. What are you looking forward to?
I'm really excited to come to Manchester. It's such a great city. I haven't been back there for years, so it's going to be really nice to see lots of familiar faces. But also actually lovely to meet new people that have got similar interests that, just may not have been on your radar. So that's going to be lovely. The other thing I really like about the conference is just going to talks that you would never normally hear about and learning about things that completely outside your area. So I'm looking forward to that too. And I was also having a look at the social programme earlier. That looks really great. So I'm excited. I can see things like going to the Northern Quarter in Manchester. That's going to be good. And I noticed Bedlam are playing again. That is always great, isn't it? They're such a brilliant band. So I'm really looking forward to seeing them too.
Yeah, no, there's something for everybody there. And I agree with you. Bedlam are just absolutely fantastic. So there's a lot for everyone to look forward to. I'm looking forward to seeing you there in person, in real life. And that, of course, is the other thing, that just getting together with people with a few days to kind of get to know each other and chat and meet up informally is just a brilliant part of the conference. So
it really is, isn't it?
Yeah, thanks, Polly, and everybody out there. We look forward to seeing you in Manchester. Do come by and say hello to us because we might not know you yet, so it'll be great to get to know you. See you soon.
Yeah,
Bye.
definitely. Thanks, Shirley. Bye.
Thanks, Polly.